You're tuned in to Women in America, the podcast that dives deep into the issues shaping gender equality in the U.S. and beyond. Hosted by Pari and Eve, public health professionals by day, content creators by passion, we bring you expert insights, compelling stories, and actionable strategies to push the fight for equality forward. Abortion access isn't just a matter of personal choice. It's a critical racial and economic justice issue. This week, we'll explore how structural inequities in healthcare and systemic racism magnify the barriers to care for marginalized communities. From healthcare deserts to the cost of access, we'll unpack why reproductive rights must center equity to achieve justice for all. Let's dive in.
I used to think that one of the scariest things about dying would be that there would be nobody who remembered you. And then this week, the United Healthcare CEO was gunned down in Manhattan, and the entire internet is almost
Gaff.
celebrating. Or they're just like, oh, yeah, we get it. And now I'm like, oh, that is a much bigger fear. Is like, oh, for you to have lived your life in such a way where the entire general public is fully on board with the reasoning. It's just intriguing that we have reached a state with health insurance in this country that people are like, yep, that makes total sense.
Not even on board with the reasoning, but they're offering a $10,000 reward, which for somebody who's worth billions of dollars is like, okay, you don't really care about finding who did this, but they're offering a $10,000 reward for the person who did it. And people are just like, I have no idea who this hero was. Nobody even wants the money. They're like, no, this was fine. We're good with it. Bye.
Yeah, I saw this tweet or post rather, because nobody goes on Twitter anymore. That was like, that's not even my minimum balance. And then I found out that apparently the NYPD asked United Healthcare if they wanted to supplement the reward. And United was like, nope, we're good.
But tell me how they know that this person traveled up from Atlanta, got away on a city bike, but they still don't know his identity. I'm like, these things tell me that you know who this person was.
Yeah, I don't know. I was asking myself the same question last night. Although, gotta give it to him for his environmental prowess. Like, the guy took a bus and then took an electronic bike. He used a silencer so he didn't wake everybody up.
I'm interested in finding out if he is in massive medical debt and therefore can only afford public transit. I think this just goes to show you how fucked our medical system and insurance system is.
Yeah, absolutely. I mean, you and I obviously we deal with the realm of reproductive health, but even outside of our professional lives, I'm almost confident without even asking you that both of us have stories we could tell about like experiencing our own issues, not just with insurance, but probably with physicians and with systems and like navigating the clinical environment. And that says people who know what we're talking about or know what we're advocating for. So I can't imagine. I mean, I can because I know what the data says, but what it's like for an average person who's not familiar with having to do all this and then not able to afford it because their insurance rejects a basic claim.
Yeah. I have to say, I think a lot about why is it that the wealthiest country in the world, in America, why is access to basic health care, including abortion and reproductive health, still a privilege for so many?
Yeah.
And you and me, who probably know more than an average American about how to navigate not necessarily the American health system, but at least like our gynecological and obstetric appointments, I still get confused. I still sometimes don't know what's going on. Do you remember when I got my IUD put in about the weird like insurance debacle that happened?
Oh, yeah, with the testing versus like the rest of the procedure.
Yeah. I went to get my third IUD put in. So this was not my first rodeo. It was my third one. I knew what to expect. I knew they were going to test me for STIs. I knew they were going to test me for if I was pregnant or not, both eligibility criteria, like requirements to get an IUD, because you can't get an IUD if you're pregnant. And my insurance, because of the Affordable Care Act, covered the IUD insertion. It covered the STI testing. It covered everything except for the diagnostic pregnancy test. Like, what? That is a requirement in order to get the IUD inserted. And nobody told me until after I already had it inserted. So imagine like going through this whole process thinking that everything's covered, and then you get a bill that you weren't expecting in
Yeah.
addition to your copay. We should not be getting surprised by our medical bills, but it happens to people every single day.
I know. And what's crazy to me is that, if you show up in an ER in the US, they actually can't even tell you what kind of a bill you're going to walk out with.
No,
Even they don't know
they don't know.
until after the fact. And one of the things about social media is that you just learn so many things that you somehow don't learn during adulthood. And one of the things that I have picked up is that if you have a hospital bill and you call and try to ask them for an itemized bill or just even ask for an explanation, they will automatically start to like reduce the cost of things just because it's very possible that they've put stuff on there that even they can't explain,
Hmm.
which should be a full-blown scam,
Hmm.
truly, that in any other context would be like, wait, there's something very sketchy, if not straight up illegal going on here. So it's amazing to me. And then again, also reminds me like the only people who are even able to call or negotiate their hospital bills are people who, first of all, feel comfortable doing that, who
Hmm.
have proficiency in English, who can understand even enough about their bill to be able to ask the right questions, right? So our system feels intentionally designed to have first built in inequities and then second self-perpetuating those inequities.
Yeah.
Like there's disparities that exist, and then the disparities just get further and further and further solidified based on everything that's happening, whether it's insurance eligibility or insurance claims, or
Hmm.
even just racial makeup, the income, the things that you have access to just based on where you live within the US geographically and regionally, which in yours and my world is about to become super, super important
Hmm.
because now that Trump is the president elect, there's so much conversation happening about this ridiculous concept of states' rights
Hmm.
that it's just going to further the divide
Yeah.
between access for people who live in different places.
Yeah, it's really crazy to me how much your zip code can affect the quality of healthcare that you receive and how much it disproportionately affects people of color, people who are not US citizens, who are immigrants. It's crazy and it's
Yeah,
exhausting to think about. And we're heading into a time where, honestly, all of our work moving forward should probably will be focusing on these communities.
yeah. I don't think people realize this, but if we just looked at reproductive age women across the United States
Hmm.
who are ineligible for health insurance, so Medicaid is what we're
Hmm.
talking about, two-thirds of those people are women of color.
Hmm.
And it's not because there's something wrong with them. It's because they are living in states that have refused to expand Medicaid accordingly.
Hmm.
And so, just purely based on regional differences, two-thirds of the women that are ineligible for health insurance in the US are automatically people of color. It's truly like wild because automatically those people are 5 steps behind anyone else trying to access healthcare of any
Hmm.
kind. And if we look at health insurance, I'm talking about health insurance because that's what everyone's been discussing. But if we look at it by race, 23% of Latina women in the United States do not have health insurance.
How
13%,
much?
23%, almost a
Wow.
quarter. 13% of Black women of reproductive age don't have health insurance. And if
Hmm.
we want to compare, only 8% of white women within the same age group don't have health insurance.
Yeah, that
So
tracks.
yeah, so for Latina women in particular, that's almost thrice
Hmm.
as much. And across the entire country, if we look at all the women of reproductive age in the US who are earning below the federal poverty threshold, right? So they're considered below the poverty line, 23% do not have health insurance, which is insane because you would think that that is the exact group for which a public health insurance like Medicaid should exist,
Hmm.
but they are ineligible either because of regional differences or because they just don't have access to it via their employers or whatever it is. And so it is kind of amazing how there are acts of discrimination that are built into public infrastructure, whether intentional or not,
Hmm.
that perpetuate already existing disparities within our country.
Yeah. I want to like illustrate this, how this works out in reality. So you are a single parent. making minimum wage, you already have kids, you're faced with a pregnancy that you were not expecting. Even if you can afford the procedure or the medication itself, whether it be through your own pockets, through private insurance, if you live in a restrictive state, this is what we mean when we talk about your quality of healthcare is determined by your zip code. If you live in a restrictive state, you have to leave the state. So your procedure or medication may be covered if you are lucky, but your airfare will not be covered. Your time off work will not be covered. Your wages will not be reimbursed through insurance. Your babysit, your like multi-day babysitter, what are you supposed to do to get that abortion if you're doing the responsible thing because you know that you cannot afford a child?
Yeah, or, don't want a child or
Or
whatever
don't
your
want a
reason
child.
is.
Yes.
And like that, compound that with the fact that, first of all, women do not experience the same amount of pay that men do in this country, right? Period.
Mm-hmm.
But then on top of that, women of color, Latina, Black, Indigenous women are at the lowest end of the wage gap. So they're already not earning the same amount as men, but now they're also earning about half the wages of white women as well, on
Mm-hmm.
average. So not only are they now not able to access the services because of where they're living regionally, but now they are also less able to afford those services compared to their white counterparts,
Mm-hmm.
which means that they are not going to be able to avail of services even if they do exist because
Mm-hmm.
they either can't afford them or they can't access them physically. So my point here is that there's so many different types of inequities that get layered into a system,
Mm-hmm.
and people often talk about like race as the only determining factor, and it's like, no, actually the reason why there are racial disparities is because there's like 18 other socioeconomic factors that are causing those disparities to exist in the first place.
Mm-hmm. And all that said, we haven't even scratched the surface in talking about medical racism. So there's a really scary statistic that the CDC reports on all the time about how Black women, especially those in the South, are 3 times more likely to die in childbirth. And that is a direct result of the different quality of treatment that they get when they're seeking care. I mean, Black health outcomes in the United States are poorer than outcomes for white people, especially white women versus Black women to begin with. And then when you talk about how that relates to women's health outcomes, specifically childbirth, it's crazy.
Yeah, we have the highest maternal mortality rate in the entire developed world. And then if you stratify by women of color, it's 3 times that. And nobody seems to be paying attention to that, even though that's like a very real problem. And instead, our legislators are like, let's fabricate a whole bunch of issues by denying people access to care. But
Mm-hmm.
it's a very real thing, like race-based discrimination. We see that all the time in terms of pain management. We talk about Serena Williams when she was giving birth in the hospital and she almost died because her doctors just didn't believe that she was experiencing what she was saying. And, she's a multimillionaire. And if it can happen to her, imagine what is happening to the average woman of color in these
Yeah.
facilities.
It's the
So,
stereotype of the strong Black woman being actualized through doctors' perspectives. And there's been studies on this where doctors have been asked qualitatively what their thoughts are on treating Black women patients versus white women patients. And the results showed that doctors genuinely felt that Black women had a higher pain tolerance than white women.
yeah, which is just crazy. And obviously, we all know this already, but there's barely any medical research that is done on women anyway.
Mm-hmm.
We mentioned this in one of our Women in America videos, but the very first time that menstrual products were even tested with real blood was in August of 2023,
Yeah,
which is
literally
crazy.
a year
But
ago.
that's what I mean. And so, like, God forbid we've done any work to actually identify what women's actual pain thresholds are, and then even less so to stratify that by color, right? But there's like so many studies that have documented women of color, especially Latina and Black women's experiences of race-based discrimination in medical and hospital settings. And they found like one, that women of color were much more pressured by physicians to use contraceptive methods that did not actually align with their preferences or their lifestyle. They were also much more likely than white women to report that healthcare professionals advised them to limit childbearing, or that
Mm-hmm.
professionals just straight up discouraged them from having children.
Mm-hmm.
And I think that there's, and not to put it all on the providers, but I think that there's like a serious lack of racial sensitivity and acknowledging that there are differences in what people experience. Some studies have even suggested that women of color may be more likely to experience contraceptive failure for some types of methods, but we've never invested in finding out what that is, or like why that might be the case, you know? So instead, people just label it, oh, well, women of color are less likely to effectively use contraceptives. And that's not actually the takeaway. The takeaway is that there are probably biological differences in our racial makeup that are contributing to these kinds of changes. And
Or they're getting
instead,
different medical advice, right? They're getting
yeah,
different
which is
medical
very
advice than a
possible,
white
right?
patient that is not enabling them to correctly use the method they've chosen. There's a lot of conversation in our small public health field about the distrust that people of color, especially women of color, have in medical systems. And it is not unfounded because the US has, you just mentioned earlier about how like doctors might give suggestions on people to limit pregnancies and things like that. That goes really far back in US history, this dark time of forced sterilization that was disproportionately used against people of color, against people living with disabilities, against people with criminal records. And we can't ignore that when we're talking about attitudes towards healthcare in America, because really just this has happened within the last century. And I think even up until 2010, they were investigating forced sterilization in the freaking camps that were set up for immigrants that they were trying to deport.
And can you imagine that women of color have gone through this or watched their mothers and grandmothers go through this, and they're still trying to trust a system that has repeatedly failed them,
Mhm.
and they're attempting to navigate it while being treated less than by the
Mhm.
system itself. And we are, for some reason, blaming them for it instead
Yeah.
of the fact it's been designed this way and is continuing to be this way. And even though the data straight up tells us, hey, when it comes to pregnancy related deaths, Black and Latina women die at 3 times the rate that everybody else does. And we're just like, oh, it must all be in their heads because they're
Mhm.
just being drunk, you know? So
Or it must be a
it,
biological thing where they're less healthy and has nothing to do with the inequitable care that they're getting from their provider, that their diagnoses are being delayed or
yes.
misdiagnosed. Just the finger pointing away from the people who have actual control over the health outcomes of women of color is unmatched in the US.
Yeah, and you know, we started by talking about regional differences. Like there are states in which sex education doesn't even exist. It's abstinence only
Hmm.
education, where contraceptive access is severely limited if available at all, and definitely not covered by insurance, especially not if you are like on a public insurance that's sponsored by your employer. So we're already seeing like there are systematic reasons why Latina and Black women are more likely than white women to experience a pregnancy that they had not anticipated. When you've never received sex education, like, and or don't have access to contraceptives, or plan B is now subject to the whims of a pharmacist to be able to give you or not, because that is actually what some states have now made kosher. How are you supposed to be able to navigate the
Hmm.
place that you live just not being very intentionally designed to not be able to get you this?
Yeah.
And like, I think people also continually discount the fact that if you are resourced, whether it's through your money or through your race, you are going to go get the care wherever it is available to you.
Mhm.
And that's exactly what white women are able to do that others aren't, all across the US, but especially in blue versus red states.
So you were just talking about some of the underlying causes of having a pregnancy you didn't expect, whether it's sex education or lack of access to birth control. Can I go on a soapbox about this for a second?
Of course, that's
Okay,
the whole point of this.
stepping up on my soapbox for something that's really not funny. It actually drives me absolutely batshit how the anti-rights movement co-ops the language of the pro-choice movement. So they did it during the COVID pandemic when they
Mm-hmm.
co-opted My Body, My Choice to protect their ability to decline vaccines. And they do it again with medicalized racism when they make cases for the fact that abortions are racist and they're part of a eugenics movement. We hear this in our advocacy community all the time where they try to make this case that because Black women mostly, but also women of color at large, are disproportionately more likely to need an abortion or get an abortion. They try to pivot the conversation to show that these women are being forced to have abortions and it's a way to limit the Black population, which is just not true because it's entirely ignoring the fact that Black women, for the reasons that you were just mentioning, have less access to all of the things that they would need to have access to in order to avoid a pregnancy that they don't want and in order to avoid having an abortion. So, the ways that anyone would avoid having an abortion is sex education, is access to birth control, is all of these other things that we just had a whole conversation about women of color are less likely to have. And yet the anti-rights try to make this argument that it is racist for Black women to have an abortion at higher rates. Well, then address the underlying issues.
Right, but they'll never do that because they
They
don't
will never do
actually
that.
care, right? That's the whole point. And
I
I
know.
know that because they never, not only did not do anything about it, they systematically deny the data that exists about maternal mortality for
Right.
women of color.
Right.
And like we've seen that in Georgia, for example, the ProPublica report that came out that looked at maternal mortality data from the last 2 years found that two different women died as a direct result of not receiving abortion care. And even though we know that they are just two of probably hundreds, they just disbanded the entire maternal mortality review committee. They did the same thing in Texas. In Texas, there were three women whose cases were distinctly determined to be as a direct result of the state policy that was not allowing them to access abortions, and they died as a result of that. And Texas was like, oh, our solution to this is going to be that we are stopping the collection of data. So there's truly, they just take the language when it suits them. And the irony to me is that we are 4 years away from the COVID pandemic. And people still say this shit of like my
Mhm.
body, my choice with response to vaccines. And I'm like, do you really not understand the difference between an infectious disease and an
Pregnancy
abortion?
isn't contagious, you
Like
know?
that's what I'm
Like,
saying. Like when you make a decision
um,
not to get vaccinated, every single person who interacts with you from that point is then implicated by that decision. When you make a decision to have an abortion, it's just you. That's it. And this is constantly like part of the rhetoric that they do, right? They can never seem to come up with their own stuff. They just like steal.
you know what's crazy to me? Going back to you were talking about Georgia and Texas. I'm so curious if before they dismantled the maternal mortality review committee, if they even stopped for a second to think about the optics of that, because it's so bold. Multiple reports of women dying from delayed care came out, and that was their immediate reaction. They didn't even try to explain why. Well, they said that somebody leaked it to the press. It's supposed to be confidential. Somebody leaked it. And since they couldn't figure out who leaked it, they were just going to start anew. But they're not going to restart the committee. They just dismantled it and are leaving it dismantled. And I'm kind of surprised there's not a bigger public outcry about this because I feel like it was pretty widely reported in the news that they were doing this.
Yeah, sometimes I think about the fact that you and I live in our own bubble, right? Because we talk about sexual and reproductive health all the time. And so the people within our circles and our followers and our audiences are outraged about this and are talking about it. But
Yeah.
I sometimes I try to put myself like, what is the general public thinking? But I have to admit, despite the fact that you and I have known each other for so long and worked together for so long, I find it a little bit funny when you're like, "Oh, I'm surprised about how bold they are." Eve, this is the GOP. Like, what? Why is this
I
surprising
know
to you?
because you know that I'm an eternal optimist, and I just hope that they're going to stop being so freaking psychotic. And you always expect the
No,
worst, which is good
no.
for our mental health. We should not be surprised by these things. And I'm like, maybe they'll just do the right thing. Maybe one day somebody in the Republican Party will do the right thing. And
I love that for you because I think that is a very good approach to have in an industry that is constantly trying to beat you down.
it's
But no,
literally the only way I survive in this world.
it didn't surprise me at all. Like think about
I know.
think about when Georgia went blue for Biden and literally 48 hours later, Brian Kemp dismantled the Voting Rights Act and created a new one that made it much harder for people of color, especially Black people, to be able to vote in Georgia. It was like immediate retribution and retaliation for the fact that people voted a certain way. That is classic, not just Georgia, but classic GOP strategies. Like every time they see something that is going in the direction that does not suit them, they rectify it in such a damaging way. When I say rectify, I mean according to their own agenda. That this is like the dismantling of the maternal mortality committee to me was, I was honestly shocked it didn't happen sooner. Like I was surprised that they actually waited until post election because the ProPublica report went viral online. And the ProPublica report, for folks who are listening, is the one that showcased Amber and Candy's deaths in Georgia and then did the same for the 3 women in Texas. So not only was it expected, but I was almost
I mean,
anticipating it to happen sooner.
I'm not surprised that they disbanded the committee. I'm surprised that there wasn't more of a public outcry, but to your point,
Yeah, that's fair.
I think people aren't tracking as closely. Also, I am never surprised by Brian Kemp because he is literally Satan incarnate in Georgia and was the same person who was Secretary of State while he was running for governor in Georgia. So he was overseeing the Georgia elections while he was running for governor against Stacey Abrams.
I know,
What
I
the
swear.
what?
If any other country was doing what we did, America ourselves would be like, this doesn't make any sense, and we should probably invade. And then we do it, but it's good stuff. Also, quick reminder for everyone listening that Brian Kemp was the very first governor in the entire country to propose an abortion ban because Georgia did it in 2019 before anybody else did, and they set the legal precedent for all of the states that came after. They did it 3 years before Roe was ever going to be overturned. So
Georgia. Weren't they also the first to introduce the personhood concept?
they were, yeah. They were actually the ones who wrote that entire case law. So that's super
Yay.
fun. A quick, funny, not so funny quip about that is when reporters asked the Republican legislators in Georgia, hey, do you understand like the 1,000 other implications that could potentially come with granting personhood to a fetus? I kid you not, the response from the Republican legislators was, no, we haven't thought about that. And honestly, we're not going to bother. And I'm just like, what? So you're granting a fetus personhood, but you're not going to answer any of the other questions or the massive gaps that it would open up legally. And they're just like, yeah, meh, someone else will figure it out. And if that's not classically the GOP for you, I'm not sure what is. It's just so like, it matches Trump's vibe of being like, I'm going to say absolutely anything I want without ever thinking through the reality of implementation or feasibility.
That just sounds like the Republican Party's game plan for everything.
Pretty much.
Okay, can we play a game, a really morbid game?
Sure.
So, we were talking about how horrible maternal mortality rates are for Black women. I am going to give you some examples of things, and I want you to tell me true or false if they are higher or lower than the maternal mortality rate of Black women in America.
Okay.
So, the game is what's lower than the maternal mortality rate for Black women in America? And why don't we do this higher or lower?
Okay. All right.
Shark attack fatalities.
Lower.
That is correct. The maternal mortality rate for Black women is much higher than shark-related fatalities. You did not hesitate, so I guess that was an easy one. Deaths from skydiving accidents.
Lower.
Correct. skydiving is statistically safer than being a Black woman giving birth in America.
Mm-hmm.
The chance of being struck by lightning in a year.
Okay, I'm gonna say lower just because the maternal mortality rate for women, Black women, is so high that I'm just
Yeah.
like,
Okay.
yeah.
I think I made these too easy. I'll have to make this a harder game later because I only had 3 of these. But you're right. You're statistically more likely to survive a lightning strike than to be a Black woman receiving equitable maternal care in America.
This is making me think though. I saw this post the other day that was saying like if pregnancy was a job,
Mhm.
it would be the 6th most dangerous job in the United States. And the first 5 were things that like the average person would not sign up to do. Coal mining, deep sea, those like deep
Oil
sea
drilling.
rigs. Yeah, oil
Wait, this
drilling.
is hilarious to me because, whenever we talk about the gender wage gap on our social media channels, the men come in and they're like, well, it's because we do the most dangerous work, so we deserve to get paid more. You have no concept of how dangerous just being a woman is in America, let
Yeah,
alone
also
giving birth.
pay me to get pregnant then. Like just I'm over here
They're like,
struggling.
we're the nation's ice fishermen. I'm like,
This is what I'm
what?
saying. I can't form sentences. I'm short of breath all the time. Even just like standing up is like painful. It's just ridiculous to say that to compare these things because pregnancy would be the 6th most dangerous job in America.
That is crazy.
Yeah. And I think that doesn't even specify what race you are, right? Like
Yeah,
that's including white women in the statistics. So if you took
which
white
pulls it
women
up.
out of it,
Yeah,
it would probably jump up much
yeah.
further than that.
That is something we do not want to be number one in.
And yet the US is like, hold my beer.
Yeah.
Thanks for listening. Access to abortion care is a justice issue, plain and simple. Next week, we'll bust myths and arm you with the medical facts about abortion that everyone deserves to know. Be sure to subscribe and let's keep breaking down the barriers together.